Hi, my name is Ernesto Diaz. I'm an internal medicine provider at Newman Regional Health Medical Partners. So it all started when I was a kid. I would go to the doctor's office with my parents and my sisters. I was the oldest in my family, so I would always go in with everyone because I spoke the best English and I was the medical interpreter for my whole family. You know, as I kind of grew up, I was trying to figure out what I wanted to do with my life, and somebody, because I was good at science, was like, wait, why don't you become a doctor? And then I started thinking, I'm like, well, you know, I have always wondered why there's never a Spanish-speaking doctor when we go into the doctor's office. So I think that would be kind of something that I look into. And then I did a little more digging, and yeah, it was something that I wanted to pursue, and luckily it worked out for me. One of the things I did in undergrad when I was preparing to apply for medical school is I would drive up to the JDoc Free Clinic in Kansas City that's run by KU medical students, and I was a medical interpreter as a volunteer there. And I remember when I went for my first night, I had to drive like an hour and a half to get there, and I was really tired. And when I walked in, because it was during finals week, and I went in through my first patient encounter, they were very thankful afterwards, because they're like, you know, if it wasn't for you, I don't think I could have been able to tell the doctors what I was feeling. And I was like, man, that was like a really rewarding moment for me. And I was like, man, I can't wait to be on the other end and being able to provide the care directly instead of being like the surrogate voice for them. When I was going through medical school, I did a lot of cool rotations and a lot of really specialized things, but I always kept coming back to internal medicine because they knew a little bit about everything. I enjoyed learning about a lot of different things in medical school and getting to learn about a lot of different diseases, and I didn't want to lose all of that and just focus on one thing. So I think the breadth and the wide variety of patients that you can see is kind of why I chose internal medicine. So as an internist, I would say the things that we're more commonly trained to treat are things like diabetes, high blood pressure. I think that's the most common things. Other things like COPD, lung issues, asthma, preventive care. You know, I kind of see my role as a mini specialist where I can treat very basic things and I could get people to the right spot. Just making it this far, it's kind of a long road, especially being son of two immigrants and having to overcome those obstacles. And it's helped me connect with my patients. You know, a lot of them walk in and like, oh, you know, I wasn't expecting to ever find someone like us who can treat us, because every time we go somewhere, if someone doesn't speak Spanish. And I think just having those interactions over and over again, it's kind of reassuring that I made the right choice in my career, not only pursuing medicine, but also pursuing internal medicine. Medicine is based a lot on trust. Trust is, I think, in medicine is verbal. Like, you know, you can't really build a trust if you're not communicating, you're not expressing, because you don't feel heard. Being able to speak Spanish helps out with that. It kind of doubles the amount of patients I can see in a way, because I mean, it opens up the door to seeing a specific kind of population. And it also allows more people to seek care, people who would usually be, you know, afraid for many reasons. Life is tough, and it's even tougher when you can't communicate when you're feeling unwell. I think it allows people to just come and see a doctor, and it opens up, you know, healthcare to more people. So Emporia is kind of a funny thing for me because, you know, I grew up in Wichita for the most part, and I did my training in Kansas City, and I went to undergrad in Lawrence. So I always drove by it. I always saw the school, like the Emporia campus and the green grass and even that little lake there. So I always kind of wanted to stop by, and then when this kind of opportunity showed up, I just felt like it was the right fit for me. You know, I think it's really important that when you are seeking care, that you try to find someone that you connect with and that you're able to relate to, not just because not only are we doctors, but we're also people. But I want people to know that, you know, my job is to try to make you comfortable and kind of address those things that have been bothering you for a while and try to make a connection that way.